Otolaryngologic examination under general anesthesia. Occasionally, a child or an adult is uncooperative and an otolaryngologic examination cannot be performed until the patient is placed under general anesthesia. At other times, as in the case of a trauma victim, the patient is already anesthetized. At this time a thorough examination of the ear, including otoscopy, nose, and larynx, is completed. Binocular microscopy. The physician uses an operating binocular microscope to examine the ear and occasionally the nose for direct, detailed visualization. Treatment of speech, language, voice, communication, and/or auditory processing disorder, individual. Group, 2 or more individuals. Under direction of a physician, the patient undergoes developmental programs such as speech therapy, sign language, or lip reading instruction or hearing rehabilitation. Nasopharyngoscopy with endoscope. The examination is performed with the patient lying on his back and under a local anesthetic with topical lidocaine that is sprayed onto the back of the throat and into the nasal passages. The physician introduces the flexible fiber optic endoscope through the nose and advances it into the pharynx to determine whether there are any fixed blockages such as a deviated septum, nasal polyps, or enlarged adenoids and tonsils. The physician may position the tip of the endoscope at the level of the hard palate and instruct the patient to perform simple maneuvers that demonstrate airway activity under conditions that promote or prevent collapse. The test may be performed to identify anatomic factors contributing to sleep disorder, stability of the upper airway, and determining treatments. Nasal function studies, e.g., Rhinomanometry. Nasal function studies are performed for analyzing nasal resistance during breathing. In rhinomanometry, the physician uses a tubular probe to generate and transmit an audible sound signal into the patient's nasal cavity through an anatomically fitted nosepiece. A microphone picks up the sound from the nasal cavity and the data is analyzed by computer to determine area distance in the nasal cavity. Facial nerve function studies, e.g., electroneurography. Facial nerve function studies, such as electroneurography, ENOG, are used to diagnose facial paralysis disorders, such as Bell's palsy, a unilateral or bilateral facial paralysis due to a viral attack on the facial nerve. These tests include an ENOG or an electromyogram that measure nerve conduction to diagnose degenerative disorders. In an electromyogram, the physician attaches small disc electrodes to the skin surface over the muscle or nerve by inserting small metal needles into the areas. The needle or electrode may be changed as needed for a complete study. An oscilloscope displays and records the data.